Hello, everyone, and welcome to Addressing Inequities as Allied Health Professionals. This is presented by the UC Alumni Association. And I also want to give a thank you to Bree Coggins, the Program Director for Alumni and Donor Experience, for putting together this session for us. I also want to thank Monica Wilkins for her support to Bree in putting this together. Monica Wilkins is our College of Allied Health Sciences Director of Diversity Initiatives and Recruitment. So I just wanted to give a couple shout outs there to the people who made this happen. I am Amy Hobeck. I am faculty in the College of Allied Health Sciences in the Department of Communication Sciences and Disorders, and I am honored to be moderating this session for you. A few just housekeeping notes. Please be sure to mute yourself to prevent feedback. We're also asking that when the panelists are speaking during the first section, that you turn off your video to help us protect bandwidth and also so that we can highlight the individuals who are speaking on the panel. This main panel discussion will be recorded and shared in the next few days. After we hear from our panelists, we will break into small groups to provide an opportunity for dialogue and question and answer with each panelist individually. In the registration, you were asked if you had a preference for which breakout room to be in. If you did not indicate a preference, you'll just be randomly assigned to a room. If you have questions for our panelists, please type them in the chat, or you can save your questions for the breakout sessions. You can either put the questions just in the chat to everybody, or if you want them to be more private, you can put them in the chat to Bree Coggins, and she will distribute them to the panelists and the moderators in the breakout sessions. And now to introduce our panelists. So we have Angela King, Master of Social Work Class of 2012, UC alum. She's the Director of Social Services for the Free Store Food Bank. She's also an adjunct instructor for the UC School of Social Work. Would you like to say hi to us, Angela?
Hello, everybody. Good evening. And I'm so honored and privileged just to be here and to share with you tonight.
Thanks, Angela. Then we have Lauren McKenney, the Master's in Communication Sciences and Disorders, Class of 2016, UC alum. She is a speech language pathologist at Riley Hospital for Children in Indianapolis. Hi, Lauren. Would you like to say hi to us too?
Hi, everybody. I am excited and honored to be here as well. And I'm really excited about this discussion. I think it's very, very, very important. So excited.
Thanks, Lauren. And finally, last but not least, Maryam Meehan, Master in Nutrition, Class of 1991. She works for the WIC program as a coordinator for the Cincinnati Health Department. Maryam?
Hi, everyone. Thanks for having me come and inviting me to share what I do and what I know and some of the things I don't know. So I'm happy to be part of this. Thank you.
Excellent. I'm excited as well. So let's get started. We're going to start out by having each of our panelists talk about their career pathway while considering the question, how do inequities manifest in your respective fields and how have you identified them? So Maryam, can you go first, please?
Yes. Well, I was first told that I should talk about my path, which is the word path just sort of makes you feel like it's a straight line, and it's been anything but a straight line. But my path started in high school with a fabulous biology teacher, and I'm not going to spend much time there, so that's about it. And because of my love of biology and life sciences, I went to college for a biology major. And then when I was in the middle of that, I wasn't really sure where that was going to take me because I wasn't really finding my niche, and then someone suggested nutrition, and that has worked well for me. So I came to Cincinnati to work on my master's in nutrition, and a friend of mine kept telling me I needed to work in public health. And I said, no, I want to be in research. I love science. I want to be in research. And she said, no, you're not a research person. You should be in public health. And so I did research for my master's thesis for about 2.5 years and learned that I should be in public health. I loved the research, but I needed the personal people connection of public health. And that's what took me to the WIC program. WIC stands for Women, Infants, and Children. It is a nutrition education program for low-income families. We serve pregnant women, women who've just had a baby, babies and kids till they turn 5. And that is a population that I am like completely crazily in love with, and it's the right choice for me to be working in WIC and to work with these populations. The inequities that I see, wow, I started to think that we, as just our own little Cincinnati WIC program, you know, we had such a lack of diversity as far as the professionals. And we used to have more diversity, and now it seems like it's changing. And as I've kind of like researched this topic to be able to speak outside of my own anecdotal experience, I think this is kind of like a national phenomenon that there is such a lack of representation for all of our represented communities. And it is something we talk about all the time. And I'm hoping to be enlightened, and I'm hoping to enlighten. I don't know. Just really want to have more people look like all of our clients. We've become much more international, which I do love, and it's exciting and stressful all rolled up into one. So I'm looking forward to this panel because I want to hear people's ideas. But the inequities for me are just across the board. To work with low-income families, I could speak for days about the inequities. I see them all day, every day, and especially with our more underrepresented clientele. So are we good to stop me now?
Of course, of course. So thank you for that insight, Mary Ann, and we appreciate it. Angela or Lauren, would one of you like to go next?
I'll go next and talk real quick about just my pathway. I actually started many moons ago thinking that I was going to be a dynamic nurse, and that was all wrong, just all kind of wrong. So it wasn't until I am an undergraduate of the University of Kentucky in Lexington, my advisor said to me, "This is not working for you. You hate chemistry, you hate math, and you're just not doing well." He said, "But you work really well with people." And he said, so I actually got a placement at the Juvenile Detention Center, and I loved it. At that time, I wasn't very good at it, but I really liked working with children and families. I graduated from there, and I worked in the field for quite a while. My journey is Hamilton County Jobs and Family Services is what brought me here to Cincinnati, Hamilton County. I worked there for almost 10 years in children's services and as a probation officer. And I think I was one of the very few initial folks that I was still able to get my license in social work before the rule changed in 1995 that you could not work without a social work degree. I'm a related degree person. So I was a sociology and criminology undergrad. And so I was able to get my license and work. And for those of you who have worked at children's services or been in the field for a while, it's been 30 years now that I've been a social worker here in Hamilton County. But I had a supervisor. Her name was Beth Casbier. I don't know if any of you remember Beth or had the opportunity to work with Beth, but she was a little bitty, maybe 4 foot, 5 inch tall Caucasian woman. And she said to me, "One day you're going to make a really good social worker." She said, "But you have to learn that it's not your job to help people. It's your job to teach people." And I remember that to this very day. I teach my students that. I tell them that. I repeat that. And so it was after working in the field for quite a long time that I went back and got my master's from UC. I worked at Lighthouse Youth Services for 13 years as a clinical supervisor for the Help Me Grow program, which is kind of, I see Mary Ann smiling because she knows all about Help Me Grow, the early intervention program and the home visitation program. I left there to go to Children's to help start and manage a case management program. It was called Health Network for Children before it actually closed down. And so now I actually still work at Children's PRN basis in psychiatry. So I've been doing this for quite a while, working with children and families in different areas and also teaching students. Currently, as the Director of Social Services at the Free Store Food Bank, we have various services there between our intake and triage department, our clothing room, and our 2 case management departments. So it gives me the opportunity to really Stay engaged. I know people ask me all the time, why do you work so many jobs? Because as an administrator, and I've been an administrator for a long time, a manager, director, I never want to forget the day-to-day and the direct practice, because that's what keeps me here. And I don't want to ever forget how to engage with families. And I don't want to ever forget that it could have been me, right? And so I remind myself of that. And we all have our biases and our judgments, but some of those things are what has led to the systemic oppression and racism that we see that affect so many people of color and disadvantage. So that's the best that I can give you. I think, what was the second part of the question? Some of the inequities in my position. When I think about housing, healthcare, mental health, substance abuse, education, it's all there for social work. You know, we're the, not just like you all in allied health sciences, we're the change makers. And so we see all of those areas that really, some of that is basic needs for families and individuals. So how do we help them navigate through that and get the equality that they so deserve? So I didn't hear the gavel yet, but I think I'm out of time. So
Technically, you have 54 seconds left. So
cool.
you were fabulous. I really appreciate your sentiment saying it could have been me. I think that that caused me to well up a little bit, even with you saying that. I think that really strikes a chord with individuals, and I think that really brings it to a personal level and a way that people, you know, can just think about for themselves as well. So I really appreciate that. Lauren, would you like to share with us your journey?
Yes, of course. So, as far as my career pathway goes, just like the other panelists stated, I initially wanted to be a lawyer. I thought I was going to rule the courtroom and be a lawyer, and I got an internship in high school at a law firm in Indianapolis, and I hated every minute of it. And then the summer before undergrad at Indiana University, I started a job at a little daycare called Small Blessings in Indianapolis, and I loved every minute of it. I worked with all ages, and at the end of that summer, I thought to myself, okay, I don't want to go into law. I want to go into something where I'm working with kids every day. And my mom introduced speech pathology to me. She actually has an undergraduate degree in speech and hearing sciences from Purdue. And she said, why don't you look into speech pathology? And I was like, what is that? So after doing some more research, I went to IU. I declared speech and hearing sciences as my major. When I got to Bloomington, I started volunteering at the domestic violence shelter there, and just to continue to work in a childcare program. So I worked in their childcare program. And then I also worked at the IU daycare. And so I had a front row seat to how environment plays a significant role in development, specifically speech and language development. So on one hand, I was at the IU daycare servicing kids who were children of the staff and professors at IU. And on the other hand, I was volunteering at Middleway House and working with kids that have experienced tons and tons of adverse childhood experiences, trauma, neglect, abuse, with significant social emotional needs. And so that kind of fueled my passion for advocating and working with this population. Then I went to the University of Cincinnati for my graduate program. I had an amazing practicum at Cincinnati Children's at the Therapeutic Interagency Preschool. And I got to see how collaborating and how multidisciplinary work is really important for kids with this background, right? The trauma, neglect, the abuse, and they were able to get all of their services through this program. And I was able to be a part of that, and I loved every minute of it. Eventually graduated from UC, moved to Chicago because I wanted to work with this demographic. So I worked at a school on the west side of Chicago with, you know, very high social emotional needs. I honestly was able to become a trauma-informed clinician, did a lot of co-treating with social work. And again, that fueled my passion for this demographic. And time again, I saw how, you know, environment or adverse childhood experiences play a huge role and language development. I ended up moving back to Indy and started working in early intervention. And so I was able to go into the home and provide therapy services. But I was also a coach, and I was a counselor, and I was connecting families to resources, and working with families with very diverse backgrounds. Then I started my job at Riley, and again, my caseload, very diverse background. Right now at Riley, I am developing a trauma-informed care program. We're trying to start a clinic. I am a part of the 3% of Black and Brown clinicians within the field of speech and language pathology. I know Maryam touched on that, about how, you know, a lot of people in the allied health profession don't reflect the clientele that they service. And I get to do that every day. And ultimately, as far as inequities go, I think that for marginalized groups, minorities, people from low socioeconomic status backgrounds, people in rural communities, lack of access to information, lack of advocacy, and lack of access to services are kind of the main avenues for inequitable care, in my opinion. So I feel like I went way over time.
You didn't. You have 45 seconds left according to
Okay.
But, you know, I'm not really precise either, but I'm really glad you didn't become a lawyer. Our field needs you, and I am super grateful for you. I met Lauren her first day. I saw you your first day in the introduction that we do with our master's students, and I immediately was like, I need to know her because she graduated from IU, so I'm also an alum. So got to know her very well. Not just because of that, just mostly because she's an amazing human. All right, so the next question, let's move on. Our next question for our panelists is, how can allied health professionals take on the structures and conditions that perpetuate inequities? What can we do as individuals in the field of allied health sciences, or what can we do, you know, within our individual disciplines as a whole? So let's see. Angela, would you like to go first?
Well, so when I think about advocacy in terms of some of the things that I've mentioned, as far as the housing, the healthcare, mental health, substance abuse, education, for me, and what I think I still also try to kind of teach my staff, my students, is that some people think that you have to be very political, like you got to be out with the rah-rah crowd, and you got to be in front of, you know, the courthouse and city council all the time. There are things that you can do right where you sit on a daily basis to advocate for your clients when you see that there are disparities, like they can't get housing, or they can't be homeowners because the interest rates are so high and there are predatory lenders, and they can't own a home. Why can't they own a home? Everybody should be able to own a home. What is the disparity there? And so being able to teach people, it's not just about being so vocal and political. It's just being active and aware, right? And so making sure that you're aware of some of the trends, some of the things, some of the laws that are being passed just right here in Hamilton County, in the city of Cincinnati, where you live, whether you live in the city or you live in the suburbs. What is happening? What is city council talking about? And how is it going to influence the dollars? How is it going to influence our clientele? And basically, how is it going to influence my job, right? And what I do on the day-to-day basis. So being able to help people understand, listen to the news, read the newspapers, tune in. City council meetings are online. You can listen to the recording. You don't have to physically be there. But when you hear something, say something, right? When you see something, say something. And so being aware of that, helping clients who feel like they really don't have a voice, because everybody does, and teaching them how to be stronger. And really, I say this to my students all the time, because I know things are expensive, but becoming members of NASW for my profession is huge, right? Understanding what is happening in our profession and how we can advocate for people who are just struggling to live day to day. What resources they can lean on, what advocacy groups are available for them, whether it is housing, or it's NAMI for mental health, or it's substance abuse. What agencies support the work that we do? Find out about that. It's not enough to say, well, I know they're out there. Well, where are they and what are they doing? How do they exist? How do they function? And being able to educate our clientele, the people that we work with on a daily basis, so that they have the same tools and information, because we're not better than, it's just I know different than you, right? But I'm not better than you. And so being able to teach them also how to have some strength in their voice so that they can advocate for themselves.
I love those thoughts and ideas. And my big takeaways from just listening to you are knowledge, advocacy, and empowerment. Sounds like those are some big takeaways. Mary Ann or Lauren, would you like to jump in next?
I'm happy to jump in. I completely agree with the empowerment, well, with everything you said, but I think a lot of the people that we serve have just for their whole lifetime sort of been not empowered to think that anybody would ever see any potential in them. And that is just such a, it's a ripoff. It's completely crazy. And even like when I'm looking at the smallest things like our no-show rate for our appointments, and then when I had my own office and I got to know my clients, and then I would say, where were you on Thursday? I had you on the schedule. And I think they were just like, oh my goodness, somebody was counting on me. Somebody noticed I was missing. And so then once I realized that that was kind of important, I made sure I always did that. And my clients were showing up and they'd come in and they go, can you believe I'm here on my appointment day? And just like so excited, just that empowerment that they matter, number one. And then once they learn they matter, well then, yeah, let's take on the bigger structures. Let's keep going higher and higher. Now, when I think of structures within nutrition, I'm talking probably about the Academy of Nutrition and Dietetics. And they've been working on inclusion and diversity for years, and we really just haven't gone that many places. So it's interesting to watch. I feel like they have a struggle, but I also feel like because of the internet, because of podcasts, because of social media, we're getting like the youth who are working towards let's include everybody. And I'm excited by the next, like, let's say 10 years, that this is going to go places that we haven't seen yet and that we need to go to. So it's pretty awesome. But I do think empowerment on the local level and on the, moving up the ladder, where we just need to address the people who are doing the credentialing and everything. We just absolutely need to be able to tell people, you can do this. You've got this. If you want to do it, how do I help you to do what you need to do for yourself?
Hey, Amy, can I say one thing in regard to what, Marian, I love what you said about them missing appointments, because even in that, we forget that we put judgment on that sometime and don't realize that they miss appointments because they have other stressors or things going on. I missed my appointment because I didn't have bus fare because I couldn't afford it. There's reinventing Metro now. They've changed their rates. And so how do we educate them about that? Oh, I missed my appointment because there was an eviction notice on my door this morning when I got up, and I completely forgot about that. So I love what you said about that. And then giving them some ownership, but making them feel valued. I was counting on you to be here. How can I help you the next time? So.
Yeah, and the transportation itself is just such a huge barrier for all things. And I would say that even in my own office, that sometimes I will see coworkers watch a mom come in who's maybe a half hour late, and how they've struggled to get there. They have 3 kids on the bus and a stroller, and they'll say, you're late, we have to reschedule you. Like, no, we don't. No, we don't. We will see you. Yeah.
In my field, in the field of speech and language, I think that one of the most important things you can do as a clinician is build rapport with your clients and with your families. And one of the ways to do that is to connect, right? So one initiative that we are trying to be more consistent with at Riley, and I guess at IU Health, is asking families what matters to them the most. What matters to you most? What's important for you today? What's important for this visit today? And that's just a way to kind of have that open communication with families. and really connect on an emotional level. I always like to check in with how the child's parents are doing. How are you feeling today? We always say, oh, hey, Johnny, how are you doing? Are you ready to start speech? But checking in with their family about what's going on at home. And that's just another way to continue to build that connection so that when there is something going on, when there's a concern, when there's a resource that they need, they know that they can come to you. And on the reverse side, you can advocate for them. I think that, like Angela and Marianne said, advocacy is really, really important. I feel like sometimes families' concerns are not heard. And so when they are going to their doctor asking for referrals for speech or OT or PT or whatever the situation may be, there may be no follow through from the doctor. That's what I see a lot is, following up and following through. So if you have a family and you directed them to this resource, follow up, follow through, make sure that they were able to access it. I think in this field, it's all about access. How can I access my services? What barriers are in place for me to get to this treatment? How do I access another service that my therapist is recommending? And I also think that as a clinician, we always talk about cultural competence, and it's specifically at UC, there's a multicultural issues course. I don't know if it's still an elective. I think it should be a mandatory course, but even with that, is it mandatory? Oh, great.
Starting this year.
Good. When I was there, it was a choice, right? Which I don't think is acceptable. We should all be striving to be culturally competent, and cultural competence is dynamic, right? I can't just take a course and now I'm competent, I'm good to go. We should be lifelong learners about diverse backgrounds and other cultures outside of our own. I always like to tell people that cultural competence is dynamic. And I think, kind of touching on what Angela said, you have to continuously educate yourself on what's going on in your community so that you best support your clients and your patients.
True.
Yes, absolutely. And Lauren, it's going to be required. I saw Dr. Soto put it in the chat, at undergraduate level and the graduate level, 2 different courses. So we are really excited about that this year. Okay, so I'm going to move on to the next question, if I can figure out how to stop my timer. And the next question is, can you discuss what stigmas or misperceptions exist in the community for members of underrepresented populations who might utilize allied health services within your different professions? I think, Maryam, would you like to go first?
Yes, sure. I think the stigmas and the misperceptions are abundant. And because I work, with low-income families, there's just a lot of judgment around your income. Take all the non-represented groups out of that, just across the board. If you are accessing a service that would be, a free service to help you, it is a huge misconception is that our clients are lazy, or that they are unmotivated. They're looking for a handout. And I am so deeply inspired by the clients that we serve. I feel as though they work really hard. Their lives are hard. They take great care of their kids. Of course, there's always going to be someone who is not this, but the general populace that we serve, their kids look amazing. They want to do right by their kids. They do everything they can to take care of business. And when you work a job that maybe is not paying you very much, let's say you're making $8 an hour and you had to get up at 4 to get your kids ready to get on the bus at 5 so you could get to the babysitter at 6 and jump the bus and go to work at Value City and come home and do it all over at the end of the day, and then do it every single day. I many times have said to my clients, thank you for reminding me how easy my life is. And I'm so in great admiration for what they do and what they get done. And because I've done the job for so darn long, I now see like some of the babies as adults. They're like 25, 27 years old. And I have a really good memory, and I remember all of them. And I know that their families have succeeded. I know that their hardworking moms have really succeeded. And you just got to know how like that feeds me, because I always knew they were going to. They were working so hard every day to just live, and then to have judgment on top of that, when really they worked way harder than pretty much anybody I knew who made significantly more money. It's just, I feel as though they need to be admired, and I find them to be very inspirational. So for me, the misrepresentation is absolutely about looking for that handout and being lazy and uninspired.
I think that some of the stigmas that exist within just rehabilitation is that, you know, there's a stigma of having a disability.
Mm-hmm.
And so, you know, some families, within some cultures, there's some shame to that too, right? They're ashamed that, you know, their child or their family member has a disability. So I think that is definitely a pretty, as far as stigmas go, that's probably the number one. And then I also thought about how there's a stigma that, or not a stigma, but there's a belief that, you know, oh, my child is going to develop at their own pace. They're going to be just fine. You know, we don't need to do therapy. And I think that, you know, having that much faith is awesome, but we also want, you know, a child to, you know, have the best quality of life that they can have. We want them to be engaged, we want them to be independent, and we want them to participate. And so, you know, getting access to education about what services look like and how they can help, I think is really important to kind of combat that belief sometimes. And I also think that, you know, I'm kind of going on a tangent, but there's sometimes the lack of just community support too. It's kind of hard to figure out who to go to in your community when you have a child that's been diagnosed with X disorder. Like, who can I talk to about this? And so I just want to say that sometimes the therapist is the first person in their community of support to kind of help them work through that the stigma of having their child having a disability, or the belief that, oh, we don't need X, Y, and Z for them to get better. So again, going back to being as supportive as you can, and recognizing and understanding where those stigmas come from.
Mm-hmm.
I think for the field of social services, some of the stigmas, of course, for those of you who are on the call who are social workers, you've probably heard that in the past, social workers were not looked upon as friendly people. In the past, our history is the friendly visitor, but not so much for me. Many people would say, you know, as I was working for Human Services or Job and Family Services and Child Protective, I would sometimes hide my badge. For a different reason. You know, sometimes that badge gives you protection, but the other times it gives a lot of judgment. People say, oh, she's coming because somebody's been a bad parent, or she's coming to take somebody's kids away, or they have a drug problem, or they're poor, or they make bad choices. Everybody makes bad choices. We all make bad choices all the time, right? And so I think things are changing and getting better with the idea of a social worker. But I think too that people still see that as being weak and not being able to take care of themselves. And so being able to give some hope to that, and to the not only to our clients but to other professionals, to say that we are support, we are change makers, we are here to support people, especially now during this pandemic. Let me tell you, we've seen more people come to us at the Free Store who have never asked for help before, and how difficult it is when we talk about case management services. They say, oh, I don't need that. You know, I'm not a drug addict, or I pay my bills on time. I'm just, you know, I just lost my job. That's not what social work and case management is about. And so educating them that I'm here to help support you in the struggle. I'm here to be a partner with you in it so I can help you get out of it, right? And so things are changing, that I think the perception is getting a little bit better, but I think initially it takes a lot of work for us to break that down, that we're not here to take your kids. We want you to keep your kids. Matter of fact, we know that you can be good parents. And I agree with Maryam to say people who we typically see are more resilient than not. They can manage. One of the conversations, and I've said it publicly and privately, that I've said to my leadership is they're concerned, like, why aren't people coming for food anymore? What's the problem? We gotta, and I said, it might be a good thing. You have to understand that people who live in oppression and crisis, they know how to function, right? COVID was a crisis for about maybe a month or two for those types of people. But after a while, they got it. They know exactly who to go to, when to go, what to ask for, and they know how to survive. And so that's a resiliency factor that people don't always see. And so it's not a weakness. It shouldn't be a judgment that I need somebody to help me. At some point in time or another, you are going to need a social worker, right? You are going to need a social worker, whether it's because you have a sick relative in the hospital, because you have a family member who is struggling, it's because you need help filling out forms for your disability or for other resources. You are going to need a social worker at some point. So it's not about because you made a bad choice or that you're a bad person. And so trying to really just break those stigmas down. And you have to understand that a lot of times people of color, minorities, they don't often come to ask for help. I tell my students very frequently, it's very infrequent that you will see a person of Asian descent or Hispanic descent come to you voluntarily for help, because culturally they don't ask for help. They've not been taught to do that because it's been deemed as a bad thing. And so being able to change that, let's change the outcome. And I tell a lot of people too, the other stigma, even among professionals who are not social workers, is, why are you doing that? You're not going to make no money. That's too hard. You're not going to like it. We do it not for the income, and you can make a good income in social work. We do it not for the income, we do it for the outcome. And so we always have to remember that.
Thank you for those thoughts. I really liked your point about the stigmas of our professions as providers, even, and it's something I didn't give a whole lot of thought to, but it really relates a lot to trust too, and how our clients trust us as providers because of the stigmas that they have, or even because of our histories of inequities with providers and doctors and allied health professionals and systems. So that really brings me to our next question, and our final question for our panelists. In just knowing that we need more allied health professionals of color or underrepresented populations, considering the pipeline of allied health practitioners, what do you think could inspire more underrepresented populations to enter the allied health fields? Lauren, would you like to start us off this time?
Sure. I think ultimately what would inspire, I like to say, historically excluded populations to enter the allied health field is basically seeing people who look like them represented in the field. So I think we could all agree that representation matters. And when you see someone that looks like you doing something of interest to you, you can literally see yourself doing it. I think in the field of speech pathology, most SLPs do not reflect the clients that they work with. And I'll say this again, that's why it's really vital for all of us to check our biases and be lifelong learners about diverse cultures that we service. Cultural competence is dynamic. And I think it's really important to create spaces and opportunities for people to see or experience, people of color or people from minority groups. Whether that's inviting them to a career fair, inviting them to do panels like this one, and other speaking events and speaking engagements. So again, being able to see yourself in someone else doing that thing that you want to do, I think is what's inspiring the most.
I would say I agree with that wholeheartedly. And I would also kind of mention the marketing that we do just overall at the university. And this is not throwing shade on anything, but when you look at in my profession or in Lauren's profession, Marian, when you look at pictures or the marketing, sometimes all you see is a dominant culture doing that. And so the perception is maybe that's not for me, or I'm good enough to do it, or it was meant for me to do. And so making sure that our marketing targets those populations of people that we serve and that we want to kind of recruit into our programs, because I think it's vitally important. Just, you know, I have become more aware of advertisements, and as much as I like beauty products and different things, I refuse to buy it if the advertising doesn't look like somebody like me. Like I can't wear a size 0 -1. They gotta look like me. So, and I'm just saying, even from a minority perspective, though, do they look like me? Because now I can identify with that, and maybe I start asking questions about it. And so we've got to pique people's interest, right? And if we don't do that, then they're not going to come. And so how can we do that better? And how can we be more intentional about the types of marketing and advertising that we do for allied health professions?
And I agree with both Lauren and Angela. I do feel like cultural competency is dynamic. I feel like there's always room to learn more and more and more. And I think sometimes as a professional, I can speak as dietitians. I think many of us want to act like we know everything instead of just asking the client who's sitting right in front of us, tell us what you are eating. Tell us how you prepare that. How can we work with exactly what they want to eat and have grown up eating instead of pushing like a dried out chicken breast and a sprig of broccoli? Let's work and be much more inclusive with everyone's culture and everyone's cultural food preferences. We've got to be better at that. Why would anybody who is different than us want to be attracted to do what we're doing if we're not really including them, or we're almost judging them for everything? Eating and food preparation is 100% personal. And so it is that you walk a fine line. You want to be offering great advice for future health, but you have got to respect everywhere everyone is coming from and make small, very consistent changes. We have a very narrow view of healthy eating across the board. And to me, that's we have so many people coming in from everywhere. I mean, we've always had the diversity of just black and white, but now we have all the Spanish speaking countries and Bhutan and, lots of African countries and Nepali. And so, the best way to learn what they're eating is to just say, tell me what a typical day of eating is, and then work with them from that. And it's really fun, besides the fact that, you're learning as we go, because it is dynamic. I love that. I love that idea. It's dynamic. And I feel like it's going to only become more and more dynamic with more and more. First of all, our food choices have gotten so big. So we've got a lot to always keep up on, at least in the nutrition field. But the other part would be, we have to be listeners. We can't just want to blah, 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 tell them what we think they need to know. We have to listen to them and how do we make a difference for them while we're waiting for more people to come through from other cultures and walks of life that will, they will be able to identify more freely with. I think the bottom line is you have to have compassion and you have to care, or you shouldn't be in any of these fields.
Absolutely. Absolutely. I like, I think it's important. I think, we've kind of talked to both of these sides of this coin of, as the majority population that is serving individuals, we have to be culturally competent. We have to know how to serve individuals, and we have to know how to build trust and rapport with individuals to serve them in the best way. But also, we have to be advocates for bringing more diversity and representation into our fields. So I think those are both really important points that all of you have brought up. All right, so we are right on time. This is amazing. I just want to thank all three of you for your insights and advice for working through some of these important issues with us. Your perspectives are so appreciated and so valued. And I've learned a lot just in this time listening to the three of you. So now we're going to break everyone out into a breakout room, and there'll be one panelist and a moderator.